How creatinine and the kidneys are related. Most people look at their lab report, see the creatinine number, and have no idea what it truly means. But that single number is often the very first signal your kidneys send when something is starting to go wrong. And the truth is, many older adults never realize how important it is until the symptoms appear. Here is the problem I keep seeing. People follow the usual advice. They cut back on salt. They drink more water. They switch to leaner foods. They get their steps in. And yet their creatinine keeps rising. Their urine still looks foamy. Their blood pressure stays unpredictable. And they start to wonder if they are missing something. Because they are. There is one pattern almost everyone overlooks. It shows up in everyday habits. Drinking water at the wrong time. Eating the right foods but in the wrong way. Pushing too hard during exercise. Or ignoring the small signs of dehydration that quietly stress the kidneys day after day. And here's the twist. Creatinine is not the problem. It is the message. A mirror of how well your kidneys are filtering waste every minute of the day. When that filtration slows, even slightly, creatinine rises. When it rises continuously, your kidneys have already been working overtime long before you can feel it. Let me explain this simply. Your muscles create creatinine every day. Your kidneys remove it. If they slow down, even for a short time, that number jumps. And if the pressure continues, the kidneys can struggle for months or even years before any symptoms show. That is why this matters. A small mistake with hydration, blood pressure, or protein intake can quietly overload your kidneys long before you feel pain, swelling, or changes in urination. By the time the signs appear, your kidneys may already be under significant strain. So, today I want to give you clarity. No confusion. No myths. Just the real science behind creatinine, why it rises, and what it means for your kidneys. Because when you understand the message, you know exactly what steps to take next. Let's begin with the basics. What creatinine actually is, what your normal range should look like, and why this number rises even when you think you are doing everything right. Creatinine is one of the simplest but most important waste products your body makes every single day. Anytime your muscles move, even when you are just breathing or walking around the house, a tiny amount of creatinine is produced. It is not harmful by itself. It is simply a natural byproduct of muscle activity. But because your body cannot use it, the creatinine must be removed. And that job belongs almost entirely to your kidneys. Here's the key idea. Creatinine does not build up because your muscles suddenly start working harder. It builds up when your kidneys cannot filter it out as quickly as your body produces it. That is why almost every doctor looks at creatinine when evaluating kidney health. It is one of the clearest windows into how well your kidneys are doing their job. Your bloodstream carries creatinine to the kidneys. Inside each kidney, millions of tiny filtering units called nephrons remove that waste and send it out of your body through urine. When this process runs smoothly, creatinine stays in a normal range. But when the kidneys become stressed, dehydrated, inflamed, or damaged, the filtering slows down. And as soon as the filtering slows, creatinine starts to rise. This is why creatinine has become such an important medical marker, especially for older adults. According to the National Kidney Foundation, reduced kidney function often develops silently for years before symptoms appear. You can visit kidney.org to read more about how routine labs can catch early changes even before you feel anything. Creatinine is one of those early changes. A helpful way to understand it is this. Creatinine is not the villain. It is the messenger. When the number goes up, it is not because creatinine suddenly became dangerous. It is because your kidneys are signaling that something is slowing them down. That could be dehydration. It could be high blood pressure. It could be certain medications. Or it could be early kidney dysfunction that has not yet shown any symptoms. So when you see creatinine on your lab report, you are not just looking at a number. You are looking at how efficiently your kidneys are clearing waste right now. It is a snapshot of kidney performance in real time. And understanding that snapshot is the first step toward protecting your long-term kidney health. Now that we know what creatinine represents and why it matters, the next question is just as important. What counts as a normal creatinine level and how does it differ between men, women, and younger individuals? Let's take a closer look at the typical ranges and why they vary from person to person. When we talk about creatinine, one of the first things people want to know is what a healthy number actually looks like. And the truth is, there is no single perfect number for everyone. Your creatinine level depends on several natural factors, including your gender, age, and even the amount of muscle you carry. According to the National Kidney Foundation at Kidney.org, these differences are completely normal and expected, and understanding them helps you interpret your lab results more accurately. For most adult men, the typical creatinine range falls between 0.8 and 1.3 milligrams per deciliter. Men usually have more muscle mass, so they naturally produce a little more creatinine each day. For adult women, the normal range is slightly lower, usually between 0.6 and 1.1 milligrams per deciliter. Again, this is not about health or fitness. It is simply about average muscle mass and how much creatinine the body generates at rest. Younger individuals, especially infants and adolescents, often have even lower creatinine levels. Their bodies are smaller, their muscle mass is still developing, and their metabolism is different. That is why levels around 0.2 milligrams per deciliter can still be completely normal for children. These lower numbers do not indicate kidney problems. They simply reflect the natural stage of growth the body is in. What matters is understanding your personal baseline. A creatinine level that is normal for one person may be high for another, depending on age, body size, and medical conditions. That is why doctors always look at creatinine in context, not as an isolated number. They compare it to your overall health history, your trend over time, and how your kidneys respond from test to test. The reason we are paying attention to these ranges is simple. Once creatinine begins rising above your normal baseline, it can be a sign that your kidneys are under pressure. That pressure does not always mean permanent damage, but it is a signal that something needs attention. It could be dehydration. It could be medication. It could be blood pressure changes. Or it could be an early sign of reduced kidney function. And that is exactly why recognizing your normal range matters. Now that we have a clear picture of what healthy levels look like, the next step is understanding when creatinine becomes too high and what different levels actually mean for your kidneys. I am Dr. Mattheus from Kidney Health 365. If you find this helpful, make sure to subscribe and like this video so more people can protect their kidney health. Now let's move on to the next section and talk about when creatinine levels become a concern. Now that we understand the normal ranges, the next important question is what it actually means when creatinine moves outside those limits. Creatinine can rise or fall for many different reasons, but not every change is dangerous. According to the National Kidney Foundation at Kidney.org, creatinine becomes a concern when it consistently rises above 1.3 milligrams per deciliter in adults. At that point, it may indicate that the kidneys are beginning to struggle with filtering waste. For people who were born with one kidney or had a kidney removed, slightly higher numbers can still be normal. Many of these individuals live with levels around 1.8 to 1.9 milligrams per deciliter without signs of kidney failure. Their single kidney simply carries more of the workload, and the higher creatinine reflects that increased filter load. However, there are levels that require immediate attention. In adults, a creatinine level above 5 milligrams per deciliter can signal severe kidney dysfunction. In infants, levels above 2 milligrams per deciliter can be equally alarming because their kidneys are smaller and more sensitive. These numbers do not automatically mean permanent damage, but they do mean the kidneys are under significant stress and need prompt evaluation. Creatinine can also rise temporarily. Dehydration is one of the most common hidden causes. When the body lacks fluid, the blood becomes more concentrated and creatinine appears higher, even if the kidneys themselves are not damaged. Intense exercise, high-protein meals, certain medications, and supplements can do the same. That is why doctors often repeat the test to see if the number remains high or drops back to normal once the temporary trigger has passed. Low creatinine, on the other hand, is usually not a major medical concern. It often reflects low muscle mass, aging, certain lifestyle changes, or recovery from illness. What matters most is whether the low number fits your overall health picture. The key idea is this: a single creatinine test does not tell the whole story. The trend over time is what reveals whether the kidneys are declining, stabilizing, or simply reacting to short-term changes. When creatinine remains high across multiple tests, that is when kidney function becomes a real concern and further investigation is necessary. With this understanding, the next step is to explore how creatinine and kidney function are connected on a deeper level and why the kidneys are so sensitive to even small changes in this number. If you are watching this, let me know in the comments if you have never checked your creatinine before type 0, and if you have checked it at least once type 1. It helps me understand where you are on your kidney health journey. To understand why creatinine is such an important health marker, we need to look at how closely it is tied to the kidneys. Creatinine is produced naturally every day as your muscles work. Your body cannot reuse it, so it must be removed. And the kidneys are almost entirely responsible for clearing it from your bloodstream. That means creatinine becomes a direct reflection of how well your kidneys are doing their job at any moment. Here's how the process works. Your blood carries creatinine into the kidneys. Inside each kidney, millions of tiny filters called nephrons pull creatinine out of the bloodstream and send it out of the body through urine. When this filtration system is working well, creatinine stays stable. But when the kidneys become weakened, dehydrated, or inflamed, they cannot keep up with the amount of waste being produced. As a result, creatinine begins to rise. This is why doctors often say creatinine is a window into kidney health. According to the National Kidney Foundation at kidney.org, one of the earliest signs of declining kidney function is a gradual increase in creatinine. It does not spike overnight. It rises slowly as the filtration rate drops. That slow rise is the signal that the kidneys are under strain long before symptoms appear. There is another important point. When creatinine rises, it puts even more pressure on the kidneys. The higher the level climbs, the harder the kidneys have to work to clear it. Over time, this extra effort can weaken kidney tissue and reduce filtration capacity even further. It becomes a cycle that quietly worsens unless the underlying cause is identified and addressed. Doctors use creatinine not only to measure kidney health, but also to estimate how well the kidneys are filtering using tests like creatinine clearance and the BUN test. These measurements give a more complete picture of how efficiently waste is being processed. When the blood level of creatinine is high while the amount in urine is low, it usually means the filters in the kidneys, especially the glomerulus, are not functioning normally. So when you see your creatinine number change, you are not just seeing a waste product. You are seeing how hard your kidneys are working. You are seeing the impact of hydration, blood pressure medications, exercise, and overall kidney health in real time. And the sooner you understand these changes, the easier it is to take steps that protect your kidneys long term. Now that we have a clear picture of how creatinine and the kidneys influence each other, the next step is to look at what actually causes creatinine to rise or fall and why these fluctuations happen. Before we continue, let me know in the comments. If this is your first time learning about how creatinine shows kidney function type 0, if you already knew this connection type 1, it helps me understand how familiar you are with kidney health. Creatinine is one of the most useful markers for kidney function, but it is also a number that can change from day to day. These changes do not always mean the kidneys are damaged. In fact, many fluctuations are temporary and caused by normal habits, lifestyle choices, or short-term health conditions. Understanding these patterns helps you avoid unnecessary worry and gives you a clearer sense of what your kidneys are actually experiencing. One of the most common reasons for creatinine to rise is dehydration. When your body does not have enough fluid, your blood becomes more concentrated. That concentration makes creatinine appear higher, even if the kidneys themselves are still functioning normally. Something as simple as not drinking enough water on a hot day or after exercising can raise the number. According to the National Kidney Foundation at kidney.org, dehydration is one of the leading preventable causes of temporary creatinine elevation. Diet can also play a major role. Eating a high-protein meal, taking certain supplements, or following a short-term high-protein diet can cause creatinine to increase because protein metabolism produces more waste for the kidneys to filter. This does not always mean harm. It simply reflects the body's increased workload. That is why creatinine is often rechecked a second time before diagnosing any true kidney issue. Exercise is another factor. Intense workouts or activities that cause muscle breakdown can temporarily increase creatinine because the muscles naturally release more of it during heavy exertion. This is common in athletes or people returning to exercise after a long break. The kidneys may still be healthy, but the muscles are producing more waste than usual. Certain medications and supplements can affect creatinine as well. Some antibiotics, anti-inflammatory drugs, blood pressure medications, and creatine supplements may cause creatinine to rise. In many cases, the kidneys are not damaged, but the medication changes how creatinine is processed or measured. This is why doctors review medications whenever a patient has a sudden change in their lab results. Health conditions that affect circulation, such as low blood pressure, high blood pressure infections, or uncontrolled diabetes, can also cause creatinine levels to shift. These conditions influence how much blood reaches the kidneys and how efficiently the kidneys can filter waste. When the kidneys receive less blood flow, creatinine can increase even without permanent injury. The important thing to remember is that creatinine is not always a fixed indicator. A single high result may not tell the whole story. The trend across multiple tests is what reveals whether the kidneys are experiencing a temporary change or a long-term decline. Now that we understand why creatinine can rise and fall, the next step is exploring the specific diseases and medical conditions that can directly damage the kidneys and cause creatinine to climb in a more serious way. When creatinine remains high across repeated tests, it is no longer just a temporary fluctuation. It becomes a signal that something deeper may be affecting the kidneys. Many medical conditions can injure the filtering units inside the kidneys, especially the glomerulus, which is responsible for removing waste from the blood. When these filters are damaged, creatinine begins to rise because the kidneys cannot clear it effectively. According to the National Kidney Foundation at Kidney.org, several well-known diseases are strongly linked with long-term kidney injury and elevated creatinine. One of the most common causes is diabetes. Over time, high blood sugar can damage the tiny blood vessels that supply the kidneys, reducing blood flow and weakening the filtration system. This slow, silent damage is why people with diabetes are routinely checked for creatinine and protein in the urine. When both begin to rise, it often indicates early diabetic kidney disease. Autoimmune disorders such as lupus can also harm the kidneys. In these conditions, the immune system mistakenly attacks healthy kidney tissue, leading to inflammation and scarring. This process reduces the kidney's ability to filter waste, and creatinine levels begin to climb as a result. The same pattern is seen in Goodpasture syndrome, a rare autoimmune condition that affects both the lungs and kidneys. Gout is another condition that may lead to kidney damage if not well managed. High uric acid levels can form crystals that injure kidney tissue, causing inflammation and reducing kidney function over time. As the kidneys struggle to filter waste, creatinine continues to rise. Certain muscle-related conditions can also influence kidney health. Rhabdomyolysis, a condition in which muscle tissue breaks down rapidly, releases large amounts of waste products into the bloodstream. This sudden overload can overwhelm the kidneys and lead to a sharp rise in creatinine. Muscular dystrophy, a chronic illness that weakens muscle tissue, can have a similar effect by increasing the amount of waste that needs to be filtered. Severe blood loss or shock can also reduce blood flow to the kidneys. When the kidneys do not receive enough oxygen and nutrients, the filtering function slows down. Once filtration slows, creatinine rises quickly, often signaling acute kidney injury. All of these conditions share one thing in common. They place continuous stress on the kidneys, eventually weakening their ability to filter creatinine and other toxins. When the kidneys are unable to remove these substances, effectively, creatinine rises as a clear warning sign. Now that we have looked at the major medical conditions that can damage the kidneys, The next step is understanding the symptoms that often appear when creatinine is high or kidney function begins to decline. This will help you spot early signals long before the problem becomes severe. One of the most challenging things about kidney disease is that it often develops quietly. Many people have rising creatinine for months or even years before they notice any symptoms at all. According to the National Kidney Foundation at kidney.org, early kidney damage rarely causes pain, which is why routine testing is so important. But as kidney function begins to decline, the body starts sending signals that something is not right. One of the earliest symptoms many people notice is persistent itching. When the kidneys are not filtering waste properly, toxins can build up in the bloodstream and irritate the skin. Muscle cramps are another common sign. As waste products accumulate, they can interfere with normal muscle and nerve function, leading to painful tightening or spasms, especially at night. Digestive symptoms can also appear. Some people experience nausea, vomiting, or a noticeable loss of appetite as creatinine rises. These symptoms occur because the buildup of waste affects how the stomach and digestive system work. Over time, swelling in the feet, ankles, or hands may develop. This swelling, called edema, happens when the kidneys cannot remove extra fluid from the body. Changes in urination are often a major warning sign. You might notice that you are urinating far more than normal or barely at all. The urine may become foamy, which can indicate protein loss. Some people experience burning or pain when urinating or even see blood in the urine. A weak urine stream or passing only small amounts at a time can be a sign that the kidneys are struggling to filter. Shortness of breath, trouble sleeping, dry skin, nerve pain, and fatigue are additional symptoms that appear as kidney function worsens. In some cases, people may experience confusion or have difficulty concentrating because waste products are affecting brain function. Pain in the back or side can develop if the kidneys become inflamed or swollen. All of these symptoms together paint a picture of kidneys under strain. If you are watching this right now, I want to hear from you. If you have never experienced any of these symptoms, type 0 in the comments. If you have experienced at least one of them at some point, type 1. Your response helps spread awareness and lets others know they are not alone. Now that we understand how rising creatinine affects the body and the symptoms it can create, it is time to bring everything together in a clear, simple way in the final section. I want to help you understand what these signs mean and what steps you can take next to protect your kidney health. Let's move into the conclusion. We have covered a lot today, so let me bring it all together in the simplest way possible. Creatinine is not just a number on a lab report. It is a message from your kidneys. You learned what creatinine is, what normal levels look like, why the numbers rise and fall, and which diseases can push the kidneys into overload. You also learned the early symptoms that often appear when kidney function begins to slip. When you understand these signals, you can act sooner and protect your long-term kidney health. And this is why taking action now truly matters. Kidney problems rarely start with loud symptoms. Most of the time, they develop silently. By the time the itching, swelling, or foamy urine show up, your kidneys may already be under significant strain. That is why waiting or hoping the numbers fix themselves can be risky. Small steps today can prevent much bigger problems later. But I want you to remember this. You are not powerless. Kidney health is something you can influence every single day. Small changes in hydration, diet, and routine can make a real difference over time. You do not need to be perfect. You just need to be consistent. Every good habit you build gives your kidneys the support they deserve. If you want to take the next step, here are 2 simple things you can do as soon as this video ends. First, review your last creatinine or kidney panel if you have one. Knowing your baseline is the first step in catching early changes. Second, make a plan to monitor your hydration and avoid long periods without fluids. These small habits reduce unnecessary stress on your kidneys. Please remember that this video is for education only. It is not a substitute for medical advice, diagnosis, or treatment. If you notice symptoms, if your numbers are rising, or if you are unsure about your kidney health, always talk with your doctor or healthcare provider before making major changes. If you found this video helpful, I would love for you to subscribe to Kidney Health 365 and turn on notifications so you never miss an update. And if you want to continue learning, watch my video Stop High Creatinine. It covers 10 low potassium foods that help protect your kidneys and may reduce your risk of future complications. I will see you there.